my name is Sylvie Savage and I'm a pet wellness advisor, and I help people with their pets anywhere from nutrition to well-being to just helping them get through some difficult times when it comes to their pets. Today, I want to talk to you about the importance of assessing your dog. And what I mean by that is physically assessing your dog, because the thing is, we are pets advocates, as you know, and when we see something wrong, or I know that intuitively we already have some pretty good idea of what's going on with our pets a lot of the times. But if you can't physically show them what the differences are, or what has changed with your pet, it's very difficult for a veterinarian to be able to see the differences, because it's from your memory, and also to pinpoint really what is going on. And so if you have a puppy, I would recommend you do this every 2 weeks to a month. It's actually fun to do. And if you have an adult age dog, you can do it every 3 months, every 6 months, once a year. It's really up to you. As a senior pet, I think that you start to increase the amount of assessments that you make, and then you start adding new ones that have to do with cognitive memory and things like that. But today we're going to, I'm going to discuss with you how to assess your adult normal dog. And so I created this baseline form for my clients. If you want one, just let me know. I'll pass it on, no problem. And on here, what I do is I like to assess the dog from the top, from the side, and then also from the front. Here I only have the top and the side, but that's just basically to see their weight or their body, if it's changed quite a bit, or if it's moved around. Like, I know as I get older, my body's staying the same. No, it's kind of depressing. But anyway, that's just me. So I'll take a picture as well. And so I will take a picture from the side, from the top, from the front. And the reason from the front is because you can kind of see if a dog's muscles are sort of getting atrophied. You can see it from the chest, because they hold a lot of muscles in their chest. Even from the back, you can start to see. It's hard to remember, but in a picture, you start to see the difference over time. And also a picture of their relaxed face. And the reason for that is because there's been some studies done, especially by Dr. Jean Dodds, who is a veterinarian out of the U.S. She did study in Canada here, but she's a veterinarian out of the U.S. who is a huge advocate for animals, and she's constantly developing new ways of assessing the well-being of our pets. And one of the things that she specializes in is thyroid health. And she's discovered that hypothyroid animals tend to develop a very deep frown on their forehead. Like over here, I'll show you with Mabel what I mean. She doesn't have it, but like right here on their head, you'll see if your dog never had that before, and then they're starting to have this, intense deep furrow on their forehead, that could be a sign of hypothyroidism. Also behavior changes, body changes, skin changes, and things like that, which are all things that you would be able to identify through assessment of your dog. And honestly, the quicker you can visualize and identify something with your pet, the better, right? Because sometimes we don't really see things or know things until it's really full blown. And so if you can identify these things ahead of time when they're starting, you have a much greater chance of recovery, or at a minimum, sort of stopping it where it is. So you take a picture of the face, the relaxed face, to see if there's a difference in the growth of the frown on the face, and any other things that might be happening. The chest, so that you can visually see if there's been an atrophying of muscle. The side and the top, to see if there's changes in the body. And also the weight of your dog is a very important thing to sort of keep track of. Knowing what your dog weighs, if they're gaining weight or losing weight, I mean, that's a big deal. And sometimes it's not as noticeable because they have all this fur, right? And you can't really tell. So that's a good thing to do regularly. Then you start to look at your dog physically and you start to take notes, because some things you can't capture in a picture. So you smell their ears, you take a look inside and see if there's any debris or wax or something that doesn't seem right or doesn't smell right. You look at their teeth, the health of their gums. Are their teeth, do they have plaque or tartar? Their breath, their tongue. You know, take a look and see if you feel any bumps or any growths or anything like that. That's an important observation to pay attention to. And then you feel, whoops, she almost fell off the bench. Aw, poor Mabel. And then you start to feel their entire body, from the neck, like the ears, the neck, the chest, the body, the tail, like, and you're looking for abnormalities, you're looking for growths, bumps, lumps, little things like that, and you take note of them. Now, you may want to have your veterinarian assess that right away. It may be something that your dog's had forever and you're already familiar with, or the vet has already assessed it and you're just now paying attention to it. But without assessing your dog, you can't really know if there's been a growth there or for how long. And so, again, it's important to assess your pet regularly so that you don't miss out on these great opportunities to be their advocate. You also then take a look at their eyes, of course. You know, you can pull back and see if it's nice and healthy pink, like a light pink. Their nails, you take a look at their nails and their paws, inside their paws. Is there a smell there? Is it uncomfortable? I also pull all the fur back as much as I can to take a good look at the skin and see if there's anything going on there that maybe we haven't noticed. On the belly too. Even take a look at their genitals and see if there's abnormalities or if there's any kind of rash or discomfort that you may be noticing or smelling. And then one of the things that I find shocking is because they have so much fur, it's amazing what you don't see. So just be thorough in your assessment, and honestly, they love it. It's fun for them. Maybe not the mouth part and the genital part, but it's fun for them. Like, they're getting attention, they're enjoying it, and you're actually looking out for them. So this is something that I get my clients to do as often as they feel like it. You just keep that information in a folder, and then when you have something that you're not sure about and you're like, oh, intuitively you're like, I'm not loving how this is going, then you can go back in your notes and say, oh, you know what, this has been happening for a long time. Even to the point where if they are getting older and you're seeing some major changes in them, you can start to videotape the behavior, right? And then you can start to really show your veterinarian or your health partner how the things are changing, because it's hard to imagine something. It's a lot easier to see it or to witness it or to actually see a change in pattern. So if you want one of these forms, please feel free to ask me. I will send it to you without any, like, charge or anything like that. And if you like the video or you're new to this to me, well, welcome, and please make sure you subscribe, like, and share, and always open to your ideas and conversation as long as they're helpful. And anyway, I'll see you soon. Bye.